learn together and grow. And today it is a moment of extreme pleasure to welcome a very acclaimed, a very beautiful doctor, Dr. Preeti Deshpande, who is present here with us, and she will be answering some of our questions regarding today's topic, which is dry and itchy skin during menopause. So before jumping to the questions directly, doctor, please tell our viewers something about yourself.
Hello, and thank you for inviting me to the Narika talk show. My name is Dr. Preeti Deshpande. I have done my undergraduation from Lokmanya Tilak Municipal Medical College, Sion Hospital, and my post-graduation in obstetrics and gynecology from Sir J.J. Group of Hospitals. I have also done a fellowship in infertility and trained in endoscopy in France. I am the founder and proprietor of Summer Clinic, and I am also attached to the Raja Fortis Hospital, Guru Nanak Hospital, and Mother Lakshmi Hospital. I am an honorary consultant at Sion Ayurvedic Hospital. I have published many journal articles. I have been awarded the Best Youth Council Member Prize for 2 consecutive years in 2016 and 2017 by the Mumbai Obstetrics and Gynec Society. I have also been the assistant editor for 2 important books, Playing by the Rules and Update on Government Policies, Regulations and Acts for Practicing Obstetricians and Gynecologists, and another book on prevention, examination and treatment of domestic violence and sexual assault cases, which is very important for the protection of women today. In my practice of 15 years, I have seen a wide strata of patients coming from different strata of society, and it has always been my endeavor to give the best quality of care to each and every patient, just as I would wish for my mother or my sister. I am not being too modest. I have always been a topper and an all-rounder, and I have varied interests in different sort of activities. I am a passionate dancer. I have trained in Bharatanatyam and also trained in hip hop. And I regularly run 10-kilometer marathons for social causes. I also have a keen interest in cooking, and I have published a book on my mom's recipes, as I wanted to immortalize my mother and pass on her legacy to the next generation. Being an obstetrician and gynecologist, I have also got a keen interest in menopause and menopausal health. In my opinion, every woman remains youthful forever and young forever.
Okay, doctor. So, doctor, which moment would you say was the moment when you decided to become a doctor?
I have always been a little different right from childhood. When I was 5 years old, my father had a fracture and he was admitted for several days. It was at that time, observing his care and recovery, that it kindled a desire in my heart to be a doctor. I believe that such a desire cannot be enforced on anyone. It can only come from inside.
That was really a great response. And moving on towards our next question, which is, doctor, what is menopause?
Menopause is a phase which comes in every woman's life. It is a time when the reproductive cycle of the woman comes to an end, and the ovaries stop producing eggs and they stop releasing the female hormones, and hence the menstrual cycle comes to an end.
And doctor, what are the symptoms of menopause?
Menopause can cause varied symptoms in the body due to hormone deficiency. The most common symptom would be hot flushes. This is a condition in which the skin heats up for a few seconds or maybe for a few minutes. It may occur several times in a day or a few times in a week. It depends upon, varies from patient to patient. Also, there may be other symptoms like vaginal dryness and decrease in sexual desire or libido. There may be weakness of muscles and bones, and also mood swings and irritability is an important symptom of menopause.
Yes. And at what age menopause occurs?
Internationally, menopause occurs in the age of 45 to 55 years. However, as per the Indian survey conducted by the National Family Health Survey, it was found that the age for menopause in India is a little lower. It occurs between 42 to 49 years. with 46 being the average age of menopause.
And doctor, what happens during menopause?
So we are born with a fixed number of eggs in our body. As we age, the number of eggs goes on declining. At menopause, this number of eggs reaches a critically low number, and hence eggs cannot be released every month. Also, the ovaries stop releasing hormones every month, and this leads to menopause and stopping of the menstrual cycle.
Yes, doctor. And what should women do when they find out about their body changes, and how do they understand?
Menopause is culturally welcomed in India, and many women may treat it as a welcome and positive change because the menstrual cycle comes to an end. However, other women may be distressed by the symptoms of vaginal dryness, decreased libido, hot flushes, and mood swings. So, if the woman is distressed or even otherwise, it would be a good idea to consult the gynecologist for the same.
Thank you, doctor. Can harmful chemicals like alcohol or nicotine dry out women's skin during menopause?
During menopause, there is a decrease in the natural oils in the skin because of deficiency of hormones. Additionally, the collagen in the skin also reduces, causing wrinkly skin. There may be pigmentation, acne, and also there may be brittle nails that may occur. These problems can be aggravated by nicotine and smoking, which is known to have a detrimental effect on collagen in the body. Also, alcohol is detrimental to health. In addition to this, caffeine can also worsen the symptoms of menopause, and spicy food can worsen hot flushes. It is best to have an improved lifestyle during menopause and hydrate well, drink a lot of water, avoid harmful fats and sweet foods, and preferably take food containing omega-3 fatty acids, which are the healthy fats. So these could be obtained from almonds, walnuts, flaxseed, and seafood such as fish.
Alright, thank you, doctor. And doctor, can menopause cause itchy skin all over?
Yes, definitely a deficiency of the hormones, as I said, will cause reduction in the natural oils in the skin. This would cause itchiness and dryness in the skin all over the body.
And doctor, how can we stop itching during menopause?
Women can take various measures like conservative measures, non-hormonal treatments or hormonal treatments. So the conservative measures would include lifestyle modification measures like not using hot water for a bath and instead using cold water for a bath. Additionally, using mild soaps, avoiding soaps that contain deodorants and perfumes. Also, a non-hormonal treatment would include moisturizers and emollients which could be applied regularly on the skin. Use of sunscreens can also protect the skin. If these measures don't work too well, then hormone replacement therapy is a good option which has been well tried in Europe and internationally. In this sort of treatment, hormones such as estrogen and progesterone are replaced in the body in the form of tablets, creams and vaginal rings. And this could reduce the symptoms of itchiness and dryness and other symptoms of menopause as well.
Yes, doctor. And doctor, tell me. Sorry. Yes, doctor. And doctor, how long does menopause itching last?
Menopause is a permanent change. It progresses over time and may present in different stages. So, menopausal symptoms are not really going to recede. Some symptoms like hot flushes may subside with time, but dryness and itchiness of skin is unlikely to subside. Therefore, it would be ideal that when menopause begins, the patient should consult a doctor and take advice for the symptoms that are occurring.
Thank you, doctor. So, doctor, do women have sexual problems after menopause?
Yes, since menopause and hormone deficiency leads to vaginal dryness and decreased libido, that is a sexual desire, it can lead to sexual problems for some patients. cause varied signs and symptoms. The first primary symptom that can help the patient to identify that she is approaching menopause is irregular cycles, and finally there will be no periods that will be occurring. Additionally, there will be hot flashes that may occur for few minutes or seconds several times in a day. There may be fatigue, decreased sleep, mood swings, dryness of the skin, wrinkling of the skin, vaginal dryness, and pigmentation of the skin as well.
Yes, doctor. And what are the home remedies for skin itching during menopause?
So, skin itching during menopause can be controlled by using cold water for a bath rather than hot water, avoiding perfumed and strong soaps, and using mild soaps. Additionally, women can also use natural moisturizers that may be available at home, like coconut oil, mineral oil, and petroleum jelly. Additionally, hydrating well by drinking adequate amounts of water, the patient's symptoms can be controlled naturally.
Thank you, doctor. And what are the creams that are used to stop itching during menopause?
So, as we discussed, sunscreens used right from the age of 30 can protect the skin. Additionally, moisturizers and emollients can be used. Steroid creams can be used for instant relief if there is severe itching at the time of menopause, and also anti-allergic medication may help in the itching to be controlled.
Thank you, doctor. And is there any pill for the woman to stop itching during menopause?
So, anti-allergic pills can be taken for short courses if there is severe itching during menopause.
Yes, doctor. And doctor, does menopause cause mental anxiety?
Menopause causes hot flashes and night sweats. Additionally, it causes a decrease in the sexual desire, and these changes can trigger anxiety in some patients.
Alright, so it's time for a short break now. We'll be back in few minutes. Till then, stay tuned. Welcome back to Anarika Talk Show. Now we'll move towards our next question. Okay, doctor. And what can women do if they have trouble in sleeping during menopause?
Sleep disturbances are fairly common in menopause, and psychological counseling, which is called as cognitive behavior therapy, may be helpful in overcoming this. Additionally, hormone replacement therapy can control mood swings and sleep problems that occur during menopause. The hormone replacement means that you actually replace the deficient hormones, estrogen and progesterone. This may be done in consultation with the doctor, and it can be given in the form of tablets, creams and vaginal rings. If these measures don't work, then you may take certain psychiatric medicines that are basically medicines that alter the composition of chemicals in the brain. These include selective serotonin reuptake inhibitors and other related drugs, and these may be helpful in controlling the symptoms of menopause.
Yes, doctor. And doctor, what should be menopause diet for the woman?
Menopausal women should hydrate well. They should avoid sweet and oily food and replace the fatty foods by foods rich in omega-3 fatty acids, which are the healthy fats. These may be obtained from almond, walnut, flaxseed, sunflower seeds, and seafood like fish. Additionally, they should avoid caffeine and also avoid alcohol and smoking.
Alright, thank you, doctor. And doctor, what should women do to improve their mood swings during menopause?
So, mood swings are due to hormone deficiency. Psychological support and counseling like cognitive behavior therapy will be helpful in that. If it is not effective, the patients can try hormone replacement therapy where the hormones are replaced into the body. And lastly, if these measures don't work, you can take a psychiatric opinion and start certain medications which alter the chemicals in the brain and improve the symptoms of menopause.
Yes. And what are the medication for dry and itchy skin?
Dry and itchy skin can be treated by conservative measures of improving using milder soaps and using cold water for a bath, using non-hormonal treatments like creams and moisturizers and even steroid creams. And additionally, anti-allergic medication can be taken for itchy skin.
Thank you, doctor. And doctor, what are the products that women should avoid during menopause?
Women should avoid strong soaps, perfumes, hot and spicy food, smoking and alcohol. Sweet and oily foods should also be avoided.
Alright, thank you, doctor. And doctor, what should be menopause diet for the woman?
Women should hydrate well, avoid sweet and oily foods, and replace the bad fats with healthy fats, which are omega-3 fatty acids. These may be present in almond, walnut, and flaxseed, also in fish. Additionally, they should avoid smoking, alcohol, and should avoid any harmful substances like excess caffeine in the diet. Soya bean products contain certain chemicals which resemble female hormones, and these should be added into the regular diet, as these are a sort of natural hormone replacement.
Thank you. And doctor, what should women do to improve their mood swings during menopause?
So, mood swings are a fairly common symptom in menopause. Psychological support and cognitive behavior therapy can be used for tackling these. Additionally, if it doesn't work, hormone replacement therapy can be given in the form of estrogen and progesterone hormones, which may be replaced as tablets, gels, or vaginal rings. If both these measures don't work, the patient can consult a psychiatrist, and certain psychiatric medications which alter chemicals in the body, such as the selective serotonin reuptake inhibitors, they may be useful in relieving these symptoms.
Thank you, doctor. And doctor, does menopause cause mental anxiety?
Menopause causes night sweats, and it also causes hot flushes. It causes reduced sexual desire, that is libido, and these symptoms can trigger anxiety in some patients.
Thank you, doctor. And doctor, what are the medications for dry and itchy skin for the woman during menopause?
So, women can use conservative treatments as we discussed, avoiding strong soaps, using mild soaps and cold water for a bath. Additionally, non-hormonal treatments like emollients and creams can be used, and hormone replacement therapy can be used for the patient as well. On the other hand, steroid creams can be used, which can instantly relieve the itchiness of the skin, and anti-allergic medication can be given to relieve itchiness of the skin.
Thank you, doctor. And doctor, what are the products that women should avoid during menopause?
Women should avoid sweet and oily foods. Also, avoid smoking and alcohol, as these can aggravate the detrimental effects of menopause. Excess caffeine intake should be avoided, and the diet should be replaced by healthy foods which contain omega-3 fatty acids, soya bean extracts, and also calcium and vitamin D supplements can be given.
Alright, doctor. So, doctor, what are the medications for dry and itchy skin during menopause?
For dry and itchy skin, as we discussed, conservative measures can be used where we avoid hot water and use mild soaps instead. Additionally, we can use certain non-hormonal.
Thank you, doctor. And doctor, what are the products that women should avoid during menopause?
Women should avoid intake of alcohol, smoking, that is nicotine. Also, excess caffeine intake should be avoided. Hot and spicy foods should be avoided. Sweet and fatty foods should also be avoided during menopause, and women should hydrate themselves well instead.
Thank you, doctor. And doctor, how long does menopause last?
Menopause is a permanent change It does not get reversed. It passes through various stages and progresses with life. Some of the symptoms like hot flashes and night sweats do subside with time, but other changes like dryness of the skin, dental problems, bone weakness that is osteoporosis, and cardiac problems or heart diseases and blood pressure go on increasing with time. Therefore, it would be ideal to consult a doctor at the onset of menopause, as the medication which could be started at this phase has the best safety profile.
Alright, thank you, doctor. And doctor, during menopause, how common is the dryness and itchiness?
Dryness and itchiness is a very common symptom of menopause. However, women may not report for this symptom because at their age there may be other comorbidities and other illnesses which take precedence, which they have to take care of.
And doctor, how do women should stay hygienic during menopause?
Hygiene could be mental hygiene as well as physical hygiene. For mental hygiene, they could take psychological support as we discussed. For physical hygiene, it would be essential to exercise regularly, take calcium and vitamin D supplementation. Also, they can consider biphosphonates for the bone health. Also, for the vaginal dryness, they could use vaginal estrogen creams which can be applied locally. This would also reduce the chances of urinary tract infections.
Yes, doctor. And doctor, what are the precautions and preventions during menopause?
Lifestyle changes are the best way to care for yourself during menopause. The lifestyle changes would include regular exercise, intake of calcium and vitamin D, antioxidant supplements, also improving a sleep hygiene, taking good amount of water, avoiding excess caffeine intake, avoiding nicotine and alcohol, avoiding sweet and oily foods and replacing it with healthy fats with omega-3 fatty acids. Additionally, applying moisturizers and emollients on the skin. Applying vaginal estrogen creams can prevent the slow atrophy and dryness of the vagina that occurs during menopause. And finally, the best precaution could be a hormone replacement therapy, where the female hormones estrogen and progesterone are replaced in the body in the form of tablets, creams or sprays.
Yes, doctor. And doctor, during menopause, should women take a hot shower or a cold shower?
A hot shower can aggravate the symptoms of dryness of skin as well as it can aggravate the hot flashes, and it's preferable to use cold water for a bath during menopause.
Alright, doctor. So, doctor, do all women go through menopause?
Menopause is an inevitable change in life for every woman when her reproductive potential comes to an end. However, some women may face menopause below the age of 40 years. This is called as premature ovarian failure. All women should definitely consult a doctor at the time of menopause, but especially so if it's occurring before 40 years of age. Hormone replacement therapy can prevent medical problems for these women, and also it is important for their longevity.
Thank you, doctor, for sharing your informative views on it. And I hope this session was really helpful for all the viewers out there. And before leaving, doctor, is there anything else that you would like to share with our viewers?
I would like to say that menopause is an inevitable change. It's a physiological change. It's going to come in every woman's life. But it's only how we view it. If we accept it mentally, it would cause no problem. And in my opinion, every woman is youthful forever.
Thank you, doctor. That was really a great response. And it really means a lot to us to be with you in an Anarika talk show. So we'll all see you in another next session with another interesting topic. Till then, to all the lovely viewers, stay happy, stay safe, stay lovely.